Okay, well, our panelist snuck in without me even noticing that he was here. So welcome everyone. My name is Linda Madison. I am the Deputy County Manager, and I am so honored to be here tonight. This is our second community briefing on COVID-19. We were really happy to have some great attendance at our last one and to share some information. I'll just note that these community briefings were a suggestion of one of our residents, and so we're really pleased to be able to have another one and provide a very diverse and a really hardworking panel that will give us some information. And also we should have some time to answer questions. As in our last one, this is being recorded. So that recording will be available for all those that, if you know anyone that is going to miss this or couldn't join us. We also know that we unfortunately scheduled against a school board meeting. So for those people that needed to attend that, they'll be able to watch this recording. We are again going to try and limit this to 60 minutes. So 1 hour, just to be mindful of everyone's time. So we'll try and get it chock full and enough information and all the information that we can in that time frame. I'm going to show you our agenda for this evening. So I will introduce our panel members. We'll get a current COVID case numbers and trends from Dr. Will Athas. We'll get some information from the community, the business community, and how they've reacted to COVID from Rin Herman. We'll talk about the senior center and how they are working through the COVID pandemic from Bernadette Luritzen. We'll talk about back to school with Jennifer Guy. And then lastly, we'll be able to get through some attendees' questions and answers. So with that, I am pleased to introduce our panel members. The first one is Dr. Will Athas. He's a retired epidemiologist, worked for UNM, and has had some experience in Los Alamos County, and he has been advising the county and doing some work for us for the last several months, and we're so pleased to have his expertise, especially at on this panel. We also have Dr. Richard Honsinger with the Los Alamos Medical Care Clinic. I think most of you know Dr. Honsinger. He's been in our community serving in capacity of primary care provider and allergist for many, many, many years. So thank you for being here, Dr. Honsinger. We also have Jennifer Guy, Assistant Superintendent with Los Alamos Public Schools. We have Bernadette Luritzen, our Executive Director of, she runs our senior centers, both White Rock and Los Alamos. We have Chief Chris Bartlett. He's the EMS Division Chief for our fire department. And one thing that this division has undertaken is getting vaccinations to our homebound in our community. So if anyone has questions about that, we can ask Chief Bartlett. We have Joyce Richens from the Los Alamos Medical Center. She's the infection prevention and employee health nurse. So excited to have her with us. And finally, Rin Herman, the director of our Los Alamos Chamber of Commerce. So with that, I am gonna turn it over to Dr. Athas. He will give us kind of the current situation in the community as far as COVID goes. Dr. Athas.
Okay, thank you, Linda, and good evening, everyone. Yeah, there we go. I was going to ask you about that. So first of all, there's some national trends and global trends going on in regards to the virus. Many of you may be aware of this, but the Omicron virus, which first emerged at the beginning of the year, and really hit communities very hard, as we can see here with the Los Alamos County case um, uh, curve, if you will. That Omicron BA.1 variant caused a lot of infections at the beginning of the year. And you can see that with the large peak there on the left-hand side. Since then, there's been a succession of different Omicron variants which have emerged and sort of outcompeted one another. And currently, we're all the way on the right-hand side of things with the Omicron BA.4 and BA.5 variants, which now appear to be accounting for upwards around 95% of all cases in the US. That will vary somewhat geographically. And within that, BA.5 is by far the dominant variant and likely will be causing just about all cases in the US within the next week or two or three, both across the US as well as likely across New Mexico and within Los Alamos County. The concern here is that BA.5, relative to the prior variants, expresses a lot more immune evasiveness as well as greater transmissibility. And so that creates a challenge for prevention activities and mitigation activities. As this virus continues to mutate and change, it just presents more and more challenges in terms of trying to control it. And so that's kind of where we're at now. Is there anything on the horizon to be worried about? Perhaps there's a variant called BA.2.75 that emerged in India and now is detected in about 12 other countries, including the US, and perhaps even more transmissible than current variants. But that's being closely monitored. And hopefully, I would like to say we're maybe at the end of the virus mutating, but nobody seems to know, and we'll just have to wait and see. What we do know, as far as reported cases in the county, and that's a big caveat because we all know that at-home testing, antigen testing is being well utilized, and we don't really have a good surveillance system for those at-home tests, which are turning up positive, unless people report them to the New Mexico Department of Health, State Health Department. So the data is being shown here are just reported cases, that is a PCR or laboratory confirmed cases. And what we can see is at the beginning of June, there was a large increase from what appeared to be a gradually increasing trend, real change in slope. There you go. That went up for a couple of weeks and peaked around the middle of June. And then it's been slowly declining, as you can see, with a little bump along the way. And we're currently down around 7 to 8 cases per day on average, averaged over each 7-day or weekly time period. The mid-June peak was around 30 cases per day. And you can see if you look back at the BA.1 peak, that was really extreme. It went up to around 90 cases per day, but was more in the range of 50 to 70. So in June, we went up to 30, and then the case numbers have been coming down. This does not capture all the cases in the county. We would like to think that the trend we're seeing with the laboratory cases is the same cases, same trend we would see overall if we combined the laboratory detected cases as well as at-home testing cases. I can't prove that. There's reasons to think that it would be similar trend lines, but I can't prove that. So we're working off of an incomplete surveillance data set, but one which we believe is informative enough to help guide our thinking and actions. So the trend at least appears to be coming down, and that's good. This is just not about infection. DOH has recently reported that around 8.5% of all emergency department visits in the county are related to COVID symptoms. That's up from about 1% or 2% that we saw back at the period of low incidence in March and April, which is kind of in the middle of the curve there. There have been 2 deaths reported in June and July. in county residents from COVID. So infection is causing other forms of morbidity and mortality. So it's still an important issue, health issue, and one which we don't have a good sense of where things might be going, particularly in regards to how the virus may continue to mutate and change. What caused the large sort of change in trend, change in slope at the beginning of June? I can't answer that. It's possible that it was Memorial Day festivities. That was the end of May, and thinking of a 4 to 5 to 7 day lag period for infections to arise. That would correspond certainly with potentially super spreader event associated with Memorial Day. And then once the virus kind of got a foothold, particularly maybe the BA.5 variant, then it just began to spread in the community. And the subsequent data charts we have will suggest that we've had pretty widespread community transmission there. So next slide, please. So this kind of complicated slide shows a number of things, but it's essentially an external comparison of Los Alamos County to the 3 neighboring counties of Santa Fe, Rio, Arriba, and Taos County. All 4 of these counties, CDC combines into what they call a hospital service area. And the way the CDC community level risk management system is set up is that it combines county level transmission rates, which are indicated here as the lines and the solid lines. And then it also combines that with hospitalization data for the HSA, the 4 county area, along with bed utilization data. So the hospitalization data is based on new admissions per 100,000. So that's a rate. And then bed utilization is a percent. That white line there basically is a common CDC threshold criteria line. Anything above that white line is bad news. Things below that white line is are better news. And basically, this is the cut point at which CDC determines the various community levels. I think over the last 3 weeks, Los Alamos has been at medium risk. It jumped up to high risk briefly around the week ending June 28th. You can see there that hospitalization rates and bed utilization were above the criteria, which pushed the county as well as the 3 other neighboring counties into high risk. But we sort of come back down. Having said that, hospitalization rates in the 4 county area still remain uncomfortably high, right around 10 new admissions per 100,000 per week here. So that's higher than we'd want it to be. We'd want it to be close to 0, actually. You can also see that Los Alamos really was an outlier back in the beginning of June. It had that big jump up at the beginning of June, somewhat unexplained, perhaps due to Memorial Day. And the other 3 counties sort of followed in trend, but nowhere near the same magnitude of risk. That is case rates per 100,000. Los Alamos County was about 2-fold higher during that peak of the current wave, and since then has come down somewhat gradually, not precipitously, but rather gradually, and currently all the way to the right for July 26th, the week ending July 26th, the most recent data we have. The county is squarely in the comparison range with the 3 other neighboring counties. So something happened. What was causing that big jump up, that would be impossible to identify in the absence of some detailed epidemiologic study, which would take a lot of time and money and probably not be worth doing at this point. But I guess the good news is that at least based on reported case data, the trend has reversed and now is coming down. We're still well above the CDC threshold of 200 cases per 100,000 on a weekly basis. And so once we hopefully break below 200, then that will continue the downward trend. but only time will tell as more data gets accumulated week by week. And the last slide, please. So this is a little bit more involved epidemiologic analysis. These are age-specific data just for Los Alamos County. And what I've shown here are age-specific rates for these various age groups, 0 to 4, 5 to 9, all the way up through 65 plus. Each one of these is a color-coded bar, and the data are displayed by time and by age. On the y-axis there is April, the months of April, May, June, and most of July up through the 21st. The point here is that with this big wave that we saw beginning in June, virtually all age groups in the county contributed to that wave, that there wasn't one particular age group that really, for whatever reason, experienced a greatly exaggerated risk. And so what that translates to is where these bars go up to in terms of the average daily reported case rate. They're relatively similar. They certainly vary, but they're not varying by 5-fold or 10-fold. What's mostly important here is that the rates in April were well below 25 for most age groups. And then by June, were well in the range of 75 to 125. So that was a pretty strong increase, again, seen across all age groups. And finally, I would just remark that the rates in the group, which is at high risk due simply to age, 65 plus, those rates have been uncomfortably high as well, higher than we'd want, particularly given that the older people typically have more severe disease and are at much higher risk of hospitalization and ultimately mortality. So that's kind of a real quick snapshot of where things have been in the county over the last 2 months or so. And like I say, only time will tell over the next several weeks where the numbers might be going. I'm aware that school starts in a couple of weeks, and hopefully these reported case numbers will continue to decline, but we won't know until the data comes in. So thanks again, and I can either take questions now or hold them off until we get through the rest of the panelists. Probably loud.
Thank you, Dr. Athos. We are going to wait. So we'll thank you for that update. I'm going to turn to Ren Herman to give us some information about the business community and how they've made changes and how they've reacted during this time. Ren?
Thank you, Linda, and thank you for putting this on. We appreciate it. It's obviously been a very difficult time for the businesses in everywhere, but specifically Los Alamos County. I think, you know, the biggest impact, or a big part of the impact, has been the laboratory being able to have folks work from home has, you know, initially really impacted a lot of folks that normally would come into town and do some shopping, do dining here locally while they're here for work. You know, initially when most of the businesses closed down, we helped a lot of folks to pivot and whatever that meant to them, go online with their sales, or a lot of the restaurants did takeout, started doing outdoor dining. And we have a restaurant listing map, actually, of all of the different food and beverage establishments in Los Alamos County and who actually offers outdoor dining. This was a suggestion by a citizen to do that, which is helpful. A lot of the businesses are still very much struggling, and it's various factors now, but it's been a very difficult time for the local businesses, especially the small businesses. Anytime you can shop local, dine local, it is appreciated. And you know, I spent a lot of time during the pandemic really pushing out who was who had online offerings, who was selling gift cards, that sort of thing. And I continue to share out the availability of grants to help people. There's a lot of businesses in town that are waiting anxiously for the ARPA funding, the federal funding, to come through through the county, basically, to help them with their COVID recovery. So that's basically my update.
Thank you, Ren. Sorry about that.
No worries.
We appreciate that. Could you just touch really briefly on some of the how businesses have maybe changed their, their restaurants or their business model during this
Sure.
time?
Sure. So there were a number of restaurants that started doing outdoor dining, started doing deliveries. There were a number of businesses that took their entire retail online. For example, the gift shop at the Bradbury Science Museum, it was in their business plan to eventually go online, but they hadn't yet. And when COVID hit and everything was shut down, they decided to just go ahead and do it at that point, even though they weren't quite ready. They took their entire offering online and survived. I know that Cricket Window, which is a retail shop downtown right across from the pond in Los Alamos, they went online through Etsy, and they put everything they had on there, and they managed to get through COVID and have done well. There were a number of businesses that closed during that time. Some were directly attributed to COVID. Others were, just during that time period. But since then, we've had a number of businesses that have opened. So it was interesting to see the way businesses were able to pivot and change their business plan. The Blue Window is a good example. They started doing a very good takeout business, and Pajarito Brew Pub and Grill started delivering, and they still will do delivery sometime. So, it changed a lot of businesses, the way they functioned. Thankfully, a good chunk were able to survive.
Thank you, Ren. We appreciate that information.
You bet.
We are going to go to Bernadette Luritzen, our director of our senior centers. And Bernadette, if you can just tell us from the senior center perspective how.
Oh, things have been a little iffy for the last couple of, I would say for the last, gosh, it's been 2 months. It's really hard to believe that it's going to be August. I would say, just my personal opinion, I like to identify now as 2 Moderna vaccines followed by 2 Moderna boosters, and still got COVID. I've been asked often, where do I think I got it? And the answer is, hopefully I get to walk through the pearly gates, and that will be my first question, because I have been, if you know me well, I have been way above and beyond doing things the right way. I do feel like masks have saved myself, at least for the last 28 months. I think it's taking all those other protective measures in addition to vaccine that's important. Ways that we pivoted during the time was we instantly started what we call a grab and go meal, and we were able to give vaccines and booster vaccines in a drive-through format, especially for those 75 and up in the beginning. We deliver library books from Mesa Public Library twice a week to homebound seniors. What I would like to say is, for anybody that, one of the things we found out during this time was the number of people that don't have anybody or don't feel like they have anybody. So if you know anybody 60 and up, they could join the senior center for free. We have so many services that are suggested donation. The truth is you don't have to pay for. So we could feed people daily. We could grocery shop for them daily, pick up prescriptions, run errands for them. We're blessed by the county and the state that allowed us to pivot and see what new ideas we could come up with. And I think it served people well, but the number of people that don't have any family here or don't have any family, has been startling, or just people that don't feel like they have that sense of community or that safety net. So we are still here for that. We have more COVID plans and policies than I care to admit. We can certainly take care of somebody that is COVID positive. We just ask that you let us know so we can keep our staff safe. I feel like this spike happened really right around that end of May time period and into June. Of the 5 to 7 day lag is because we were just seeing people that wanted to get out. And I think that graduation time period, when kids were graduating from both college and from high school, people were just going crazy so they could go to parties. And it really was social media for me that made us make some different plans. When I could see regular people, I'll just go with my age, saying, "Oh, you guys, I've been at a lot of graduation parties this weekend and I tested positive. Sorry, just want to let you know." And I like to joke that I'm your senior center mother, and to say to those people, if you were in a conversation with somebody that's a senior and you don't know them to be on social media, it's your due diligence to call them and tell them you have COVID, because everybody doesn't have that technology skill or desire. And that's when we had to make the decision to go back to masks for the senior center, because I was just afraid of what was coming for us. So we're currently in masks. I think that could change soon because we're seeing an improvement. I think a lot of changes are coming our way. We are legislated by the state as well as the county as far as what we're doing. And then in this most recent case, it was our decision. Staff has always been in masks throughout this duration. It's my personal belief that it's because if everybody else goes down, that staff is safe and we can still take care of seniors, whether that is with transportation or home delivered meals or drive-through meals. We have so much to offer at no cost, and that's an important message to get out. We have pivoted a lot of different ways. One of the first ways we did is, again, it was social media, and Elizabeth Coons, one of my employees at the time, said, there are a lot of people that are saying, "Hey, seniors, I can come help you with all your things and do your shopping." And that just gave me a big icky feeling. And so from that moment on, we started the Senior Services Fund so that people could make donations for seniors that were struggling. We have a lot of seniors that are struggling, especially younger seniors, or again, seniors that don't have family here. And so that's really helped us, whether it's purchasing someone's additional food, or medicine or medical supplies. We also started a fund called the Staff Morale Fund, because we've never thought we'd be in it for this long. And in doing that, because staff isn't allowed to take tips or gifts more than, worth more than $10, that fund, we decided that every penny that we get in that fund to benefit staff, we use to purchase from a local business. So we might buy, scones from the Pig and Fig, or we might buy biscuititos from not Rigoberto's, but El Parasol, because it was a way that you're helping me help my staff to keep them motivated when times are tough, but also to help the local business community. And we also use that fund to recognize one of my board members, John Bailey, said, "What about if we recognize an employee of the month?" And so we started with an employee of the quarter with some funds from the community foundation and again from donations. And we also decided to use those funds so that each employee of the quarter gets a $100 gift certificate to a local business, just in another way to help support our local businesses during that time. We are not doing indoor dining currently. I think we are leaning back toward doing that again, but just for everybody that's worried, the drive-through dining will stay the same, because financially we can't afford not to do both. We don't see people return to indoor dining no matter how many times we've tried. The numbers are very small, and financially we just can't survive on that low of a turnout. So it will stay, but I think it's coming back soon as well. Some changes to our transportation program. We get there, so kind of one step forward, two steps back, or two steps forward, one step back. But we've been very lucky. But we got hit hard there for a while with COVID ourselves, and that's, it's always my job to make sure my staff is safe as well.
Thank you, Bernadette. Appreciate that update from the senior centers. Lastly, of just our quick updates, we'll go to Jennifer Guy, our Assistant Superintendent of LA Public Schools, and school is starting August 10th. So just want to hear how the schools will be starting and what kind of policies you'll have in place for that.
Thank you. Thank you. Thanks for letting me come. Well, we've been, most of our staff have been off all summer, right? So principals came back this past week. The rest of staff come back next week, Wednesday the 3rd, and then we have students the following week. So we're getting new policies together. We got an updated toolkit from PED. So we are working on getting information out to parents. So for those of you that have students in the school, be watching, you'll get more and more. I sent an initial email today with links to the new toolkit along with our COVID mitigation strategies. We had started working on some of those last year with the COVID task force, and we had a group of people that were still in contract over the summer working on them. And so we will be following CDC guidelines along with the New Mexico public education guidelines. Some of the very basic, just quickly, precautions that we'll be taking. We will be requiring masks if indoors, if the county moves into red as determined by the CDC. So we will keep sharing links to that website. Staff will continue to require staff to be vaccinated and boosted, or they'll have to test weekly. And so we've got a big shipment of COVID tests. Just in fact, last week, some more in. We now have, thank you to the county, have air purifiers in every classroom, in addition to meeting all of the ventilation standards. So we feel like we're ready to start school. Thank you to the community for being patient with us as we get info out. Like I said, as principals are just getting back. So just as quickly as we can get staff back in the door, we will start getting that information out. School starts on August the 10th. Right now we're still in the yellow, as according to the county. We'll check that every Thursday and communicate with families what that means for the next week. There's a ton I could go over, so I'm just going to stop there, but I'm happy to answer any questions, and then we will get more information out through our school email systems as quickly as we can. We had a good summer. We did have some kids that were on campus all summer, and I'm happy to report we had very little COVID spread or among the students that were here or the kids, the staff that were working. So we'll keep, hopefully we can keep the good measures in place that we've got. Thank you.
Thank you, Jennifer. And I'll just clarify that the CDC community level is high, would be equivalent to the red. Right now we're in medium, which I think on the website is indicated with yellow. So
yes, thank you.
Just to make sure that we are all talking the same language. Perfect.
Absolutely, thank you.
Well, we have been having questions throughout this. Let me just share my screen real quick. And as we open up for questions. Okay, so if you have a question, I know people have been putting them in the Q&A feature in Zoom, but you could also raise your hand if you want to ask a question. So I'll ask all panelists to turn on their cameras so we can see you. And I'm going to turn to Julie. Do you want to start asking questions, or if you see any hands raised?
Thank you, Linda. Thank you, everybody. I do not see any hands raised, but we do have a question that just came in through the chat. The question sounds like it's for you, Jennifer. Why wait until we go to red to mask up at school? Why not at yellow status to prevent going red?
You know, just really, many would ask the same question about why not in green. Overwhelmingly, that's where the majority of our parents have indicated that they are most comfortable. That's where staff have indicated that they're most comfortable. And we need some consistent guidelines to follow. And that is what the CDC has recommended. And that is what the Department of Health and Dr. Scrace have recommended. And so that is the advice we're going to rely on.
Thank you. We also have Lauren Copeland, who is raising her hand. Lauren, you should be allowed to unmute yourself and ask your
Yes.
question.
I wanted to follow up from the last meeting about the wastewater monitoring and whether or not there's a place where that we can look at that data from the county. It's not been updated regularly on the CDC website, and I know that they don't include White Rock at all. I think that's very useful information and should be used in a lot of these decisions, like with the schools, and particularly because high or the orange or red has to do with hospitalizations. And so it's very much a lagging indicator. By the time that we hit red, cases tend to be going down because hospitalizations happen 2 to 3 weeks in. And so that's somewhat frustrating to hear that we're going to wait until cases are going down to use masks. So those are the two things that I wanted to ask or say.
Thank you, Lauren. I'm going to turn to Dr. Athos to talk about the wastewater and just know that we probably can't answer everything right this second, but we do have plans to kind of do a deep dive and give some more information about it in the future.
Okay, yeah, that's a good question. The county's been participating in this wastewater surveillance program with CDC for a while now. They switched contractors on us, and the current contractor is providing data reports to the county. They're also providing their data online as well as feeding that to CDC. Both the contractor and CDC are displaying data using different smoothing and different sort of analysis measures, so they're not directly comparable. What the contractor is providing are average data as well as CDC. They've been normalized, and what they're providing the county is the actual raw data. So we've been starting to look at that. It's important to recognize that the current contractor did not start sampling the middle of June. So we missed the front end of the wave, the current wave that we're in. So we don't really have any good reference points for when we had a lower incidence period. But we do have data now that's spanning about a month or 6 weeks of biweekly sampling. I agree that these data may be particularly useful to kind of gauge just where transmission is at in the community, just how low the numbers might be able to go, which would provide reassurance. Having said that, both the White Rock facility and the Townsite facility, the service populations are relatively small. So we have a small sample size, and the weekly data can be fairly erratic. So it's going to be a challenge from a statistical point of view to analyze these data and get some real clear trend messaging, because the weekly numbers or the sampling points can vary dramatically by an order of magnitude without any real clear and obvious trending. So that's kind of where we're at. I'm hoping that next week's newsletter, we can develop a section on wastewater monitoring and come up with a plan, if you will, to incorporate the contractor's version of the data, CDC's version of the data, and perhaps a local version of the data to help inform the community in regards to safety and whatever preventative measures might be needed. And lastly, the issue with the CDC community levels, Lauren is exactly correct that these are really based largely on hospitalization data, which the county, again, is in a 4-county health services area. And the community transmission rates can go up pretty high before we get into a high risks level by CDC's sort of protocol, if you will. And so I think everybody in the community needs to be aware of maybe some of the limitations in the CDC community level metric that's being used here. So I hope that helps.
Julie, does Lauren have a follow-up to that? I'm sorry.
So actually Lauren does. Lauren says that wasn't my question. My question was, where is the public access that was promised during the last meeting?
Okay, so in, I think, I don't know if it's last week's newsletter or the one prior to that, I think it was last week's newsletter. We provided the websites for both the contractor public access as well as the CDC access. So that's where you can go to look for that, the wastewater surveillance data. And again, it's important to recognize that the contractor and CDC are presenting the data in two somewhat different fashions, in two different ways.
Thank you. Okay, Julie, next question.
So the next question is, do the schools have CO2 monitors, and how is this information being used? If it goes high, what will change?
That's a good question. We actually do have CO2 monitors on all of our ventilation systems. And so we have the ability to adjust and set those where they automatically adjust the airflow. We can bring in any percentage of outside air in and mix it with recirculated air. And so our facilities manager, Tom Castillo, and his crew are monitoring that frequently. When COVID first began and we updated filters in some of our systems, they have those set higher so that they're triggering more quickly and bringing in more outside air than we did prior to COVID. But those systems work in every occupied space in the district.
Great, thank you. Do we have another question?
We do. So the next question is, where can one get Paxlovid in Los Alamos County if they test positive?
Dr. Honsinger, could you help us with that one?
I think that almost every pharmacy has Paxlovid. There's not a shortage of Paxlovid, which we're surprised, but we've been adequately supplied. Pharmacies here, pharmacies in Santa Fe, pharmacies in Espanola are carrying Paxlovid. And it's, if you get the illness, if you're severely ill, it is definitely worth taking it.
Dr. Honsinger, I know most people would get a prescription from their primary care physician. There was also some news about possibly pharmacists would be able to write those prescriptions for individuals. Do you have any?
Sorry, I know that's a proposal, but I have not seen that that the state has come out with an edict that they can write the prescriptions. Most of your physicians will believe you if you say, I have COVID, I have a positive test, and they'll call in the Paxlovid for you. The trouble with Paxlovid, it's a drug that's effective. It's effective at getting rid of the virus. It's also effective at changing the metabolism of multiple other drugs. So if we put you on Paxlovid, we need to know what else you are taking. Some of the drugs that are antidepressants, for instance, only metabolize half as fast when you're on Paxlovid. Paxlovid is a medicine that kills virus and a medicine that slows the breakdown of the active ingredient, and that works very well for some other medicines to slow their breakdown as well. And it's a mixed bag because it even speeds up the breakdown of some other medicines. So we're learning to go to the lists and to go to the literature, and it takes a moment to get the response if you come in with the medicine that's unusual, people don't usually take, to see what the effect is going to be. Because probably a fourth of our medicines are metabolized by the liver, and it changes liver metabolism, sometimes adversely, sometimes beneficially.
Great. Thank you. Julie, do we have another question?
The next question, has there been any change in the way COVID is spread? Is it still aerosols?
Dr. Athos?
Probably not too much change in the actual exposure pathways. What's changing is the efficiency of the virus to infect cells and its ability to evade the immune system. But right now, the belief is that most cases, the exposure pathway is through airborne mechanisms, and more than likely still the relatively large droplets, which are spread within about 6 feet of a talking, sneezing, coughing infected person. Having said that, there is evidence for a much more scattered sort of airborne dissemination of smaller particles, which may be maintained in the air for more significant amounts of time. So generally, yeah, enclosed indoor space where the ventilation is relatively limited. If someone is in there infected and coughing, sneezing, or talking, not only within 6 feet, but likely throughout the room, depending on the time in there, virus particles will distribute throughout the air. And that's what we're mainly concerned about, and why we continue to talk about the possibility of a need for masking and social distancing and avoiding crowded indoor spaces.
Dr. Hunsinger, did you want to add to that? You may still be muted.
Yeah.
See, I just kind of reinforce what Will says, is that masks work. So when you see people wearing masks, don't criticize them, look for your own mask.
Thank you. Julie, next question.
The next question, is the county receiving any guidance information regarding monkeypox?
You know what? Let's skip that one.
Okay.
Because we'll try and deal with that another day.
Okay.
Sorry.
Los Alamos Public Schools clarification on vaccinated and boosted. Age 50 and above are eligible for another booster. Is this required under that guideline, and does that need to be documented? Thank you.
Yes. So if you're eligible for a booster according to the CDC guidelines, then yes, you have to have a vax booster, and you have to provide the documentation to HR, or else you have to provide weekly test results, just like last year.
Okay.
The next question, will schools follow the same policies to switch to distance learning if cases rise as last school year?
Not at this time. We're going to approach it a little bit differently. So we had set 3%, not us. The public education department had set 3% and 5% thresholds. They did not do that. We are committed to remaining in person as much as we can. So we'll monitor it on a situation by situation basis. When we switched to that last year under PED's direction, we did monitor classrooms, so there were times where we had to put an entire class at home in remote learning. So we may have had several, say, third graders in one class that tested positive. So we removed that class to remote learning for a period of 10 days. And then when we returned them to school. So we are not looking at closing the entire district unless something dramatically changes. And we'll always continue to monitor the situation, but we will take it on a school by school, case by case basis. And we know that keeping kids in school is very important for some of our kids. We want to keep everybody safe, but we believe we can do both. And honestly, we had some school spread, but we still have not seen a lot of in-school spread. They've been in isolated cases.
So we have another question about schools. I realize Ms. Guy said all occupied spaces have CO2 monitors. Does that include the portables that aren't on the main building systems?
Yes. So all of they're put in place through our HVAC system. And if you're a school employee, if you'll email me, I'll send you a link to a video where Tommy Castillo explains that really well. And we're also happy to show you around the site. And so you can see how those exchanges work. Same thing with community members. If you'd like to take a look at the systems, we're happy to arrange an appointment for you.
The next question, how safe is it to be outdoors in a crowd without a mask?
Dr. Athos?
Well, safety is a sort of a subjective term, and everybody has different risk tolerances. The reality is with right now, BA.5 is probably as transmissible a virus, a coronavirus, as we've seen. Some estimates, early estimates, gave it a factor of made it comparable almost to measles, but that's been sort of walked back. I would personally, I would be reticent about being out in a very crowded space outdoors, simply because all it takes is one person. And if it's a concert or if it's some event where somebody is vocalizing loudly or just talking loudly, there's going to be virus out there. So the risk is not zero being outside. The risk is lower if you're outside. The risk is lower if you're outside and you're not around people. And the risk is even much lower if you're outside around people wearing a mask. But these are all measures which folks in the public and governments are remiss to maintain. So it becomes a matter of the French phrase, débrouillez-vous, which means it's up to you to kind of figure it out. And you have to ascertain your own risk profile. My personal opinion is that right now with BA.5 circulating, and maybe some other more nasty variants on the horizon, I would not take my chances. But it's up to each person to weigh out the risks and the benefits. Why are you there and doing what you're doing? So my response would be no, it's not particularly safe right now.
Hey, Julie, I was going to ask a question of Chief Bartlett so he can give some information. If you had a family member that you was homebound and they wanted to be vaccinated, how would they contact you, or what process could we go about to get that done?
So currently we're having the county social services field all those calls. So you can call Eloisa. Her number is 663-1876, and I'll put that in the comments there.
Perfect.
But yeah, you'll just schedule through her. She'll relay that information to non-Bay Drugs, and they'll schedule me to go out and give the vaccination. We're doing, there's a rarity to do an initial vaccination, but we'll do those also. It's not just boosters.
Great. Thank you. I appreciate that. Julie, more questions?
Let's see. So in the email today from Jennifer, it was stated that it's important to ensure that disabled students can access in-person education. What actions are being taken to protect high-risk students?
All of our high-risk school students, we work directly with their families and their teams to make sure that they have a medical plan in place, or we have specific accommodations in place. And so we have such a wide variety of different risks that's a difficult question to answer because everybody needs something a little bit different. But we are working directly with all families individually and with their teams to make sure we've got appropriate accommodations in place.
And Julie, I just wanted to give Joyce just an opportunity to, if there was any information from the hospital that you wanted to share before we start to conclude.
Thanks, Linda. I think just, we are continuing to require masks of everybody that enters the hospital. If you come and you've forgotten your mask, we have some to provide to you. So anywhere you go in the hospital, whether you're going to a clinic or the lab or to visit somebody, we will be asking that you wear a mask and keep a mask on. So, and we also ask that if you are not feeling well, that you don't come to the hospital to visit. And thanks.
Great. Thanks, Joyce. Okay, Julie, is there, probably have time for maybe one more question?
So there was a clarification question in regard to the extra booster. This person is saying, for example, I turned 50, I'm vaxxed and boosted. Do I need to be boosted again and to provide documentation? This was in response to the earlier question about the schools.
And is Jennifer, okay. I know we're keeping.
Sorry. So can you hear me?
Yes.
I lost my kid. We lost our internet. We lost our internet, so I had to go outside. So that's a difficult, I'm not sure looking at your specific situation, and I don't have the guidelines in front of me. So I am not sure. I will send out more information, but if according to the CDC website and the definition of fully vaccinated, Dr. Athos Mike can help us understand that. Then if that's what it says for you to be fully vaccinated, then that's what you have to provide. But if you'll follow up with me by email or reach out to Joe Palmer in Human Resources, he will help you understand what you need.
Perfect. Thank you. So before we say goodbye, I just wanted to remind our community that we are hosting a couple of vaccination clinics. We are partnering with Premier Medical Group, and they have been providing, so far we've provided 2 for our young children, ages 6 months to 5 years, as they start their vaccination series. And so we're continuing to plan those and hold those vaccination clinics so that those young ones can get the whole series completed. So the next 2 vaccination clinics are scheduled for Monday, August 1st and Monday, August 8th. They will be held at the First Baptist Church between 10 a.m. and 2 p.m. And so you're able to register. If you need more information, please call the county. And I'll just note that for the August 8th clinic, we are opening it up to anyone who is eligible for vaccine. So if you need a booster, if you're over 50 and you need that 4th booster, or if you need any of your boosters, we're going to take all age groups. So it's a good opportunity locally to get those done. Is there any other last minute comments from our panel? Oh, Bernadette, you're muted.
There we go. Sorry about that.
No problem.
I would just like to beg everybody to please be kind to the Smith's pharmacy staff and the Nambe pharmacy staff. They're working so hard, and I haven't even announced it to anybody yet, but we actually put a proposal. So we will, if you're a member of the senior center, we will be happy to pick up your prescriptions for you. But we have proposed to them that would they allow us to, we already have the latitude and have a protocol in place for picking up prescriptions, but would they consider allowing us to pick up many senior prescriptions? So either the senior center could be the place to pick them up, because I've heard and seen so many people that can't be standing for long periods of time. It is not the fault of the pharmacy staff, but we're looking into that. It doesn't mean they'll agree to what we're suggesting, but as a minimum, if you know somebody too old to be standing in line or too frail to be standing in line, they just need to make a connection to the senior center, and we don't charge anything for that. They just reimburse us for the cost of their prescription. Thank you.
Dr. Hunsinger?
I know there are some people who are saying, oh, I'll just get COVID and it'll be over. Turns out it doesn't work that way. Getting COVID doesn't protect you from getting COVID again. Getting COVID doesn't protect you from getting the myocarditis. Doesn't protect you from getting the long COVID syndrome. So you don't want to get this bug.
Great. Thank you. Ren?
I just want to say thank you to everyone for continuing to support our small local businesses. It's, it just continues to be crucial to support them. If you want to see these small businesses stay here in this town, we need to frequent them.
Thank you, Rin. That's a great reminder. And I'm just going to end with letting you know, like I said, we are recording this. That recording will be on the county website sometime tomorrow, probably in the morning. We have waited to release our weekly COVID newsletter so that the link to this recording of this briefing can be available as part of that newsletter. So look for that. And if you have not subscribed to our weekly COVID newsletter, please do. All things COVID we can find them at our Los Alamos website, as I note here. And please, we are looking for any and all feedback about the COVID newsletter, the county's, these briefings, anything. You can send that feedback to county COVID team at lacnm.us. I want to say a special thank you to all our panel members. We appreciate you taking the time to help our community with this time and help educate and answer questions. And with that, we will close. And if there's questions that we did not get answered, we always try and throw those into our newsletter. So we have a transcript of the question and answers. So everyone, please have a great evening, stay safe, and thank you again for joining us tonight. Thank you, guys.
Good night. Thanks.
Sure, thank you.